Canoes neonate with plethora seen in TGA transmission of great arteries. Canoes neonate with plethora seen in transmission of great arteries. Question number 56. Female with check on calculus and training science in lumbar region, xanthochronal spinal apparatus. Check on calculus for training science in lumbar region, seen in xanthochronal spinal apparatus. Question number 56. 57. 7. Eugenic mass and kidney on ultrasound and CT shows fat density, tetanosis, and myelopoma. 58. Child with men involved in vein plus aniridia, Wilm tumor. Multiple granuloplasia plus aniridia seen in Wilm tumor. 59. Cytography indicated in unilateral blood chain discharge. Repeated. Question 60. Recurrent breast macrocalcification 10 to 30% of malignant on biopsy. Question 61. Macrocalcification with branching and leading to nipple is seen in invasive carcinoma and invasive ductal carcinoma. Question 62. Central renal axillary lymph node is seen in lymph node take up dye malignant is seen in breast cancer. Central axillary lymph node. Now the scenarios are that lymph node takes up dye and is seen in malignancy and is also seen in breast cancer. So these are the related scenarios. Question number 63. Spinal arteritis lies posteriorly. 64. Multiple sclerosis shows polyclosal high total signal. 65. Diving injury is Jefferson factor. Diving injury is Jefferson factor. 66. Meningomyelocele 95%. Cerebellar hyperplasia plus herniation. It's seen in meningomyelocele. Question number 67. Idiopathic intracranial hypertension. Dilated silver inferior with dilated ventricle. In idiopathic intracranial hypertension, we see dilated silver inferior with dilated ventricle. All CRE types is type 1 shows herniated tonsils or peg-like tonsils. CRE 2 shows encephalocele. CRE 2 shows herniated tonsils plus meningomyelocele, and CRE 3 shows encephalocele. Question 68. Toxoplasmosis was an lymphoma, CNS, hyperclarity seen in toxoplasmosis. 69. Coughing and fit child, hypothalamic hamartoma. Coughing and fit child seen in hypothalamic hamartoma. 70. Behavioral fits is seen in hippocampal scarring. Behavioral fits shows hippocampal scarring. Question 71. Subepidermal lesion plus brown spot plus mental retardation seen in tuberous sclerosis. 72. Trauma pain with aortic irregularity plus right mediastinum. Diagnosis is P. Transection. Aortic irregularity plus right mediastinum in trauma patient seen in transection. B. 73. Aortic corrugatorium with left side notch apparent right subclavian artery. Also posterior endarterectomy seen in apparent right subclavian artery. Question number 74. Scenario of congenital disease. Right heart wall abnormal. Diagnosis tricuspid atresia. 75. Osteomyelitis 100% best is MRI. Osteomyelitis best again is D-texanium 99 mmDP. Repeat. Here the answer. Osteomyelitis 100% best is D-texanium 99 mmDP. It is also used for giant cell tumor. But some another option might come that osteomyelitis best investigation is MRI. And in acute osteomyelitis best investigation is indium. In chronic osteomyelitis best investigation is gallium. 76. Most common neural tube defect is anencephaly. 77. Spread of cervical carcinoma is seen by parametrial stranding of tissue. 78. Cyclic hematuria with stricture in urethra is seen in endometriosis. Now hypothalamic glioma occurs in greater than 3 years of age patient. Hypothalamic glioma occurs in greater than 3 years of patient. Question 79. Signet ring subpapular seen in necrotizing papillaritis. 80. Medial deviation of ureter seen in retroperitoneal fibrosis. 81. Cross-fluid ectopia and ectopia on one side is seen in ureteric insertion orthopically in the respective side in UP. Cross-fluid ectopia and ectopia on one side is seen. What does it show? It is ureteric insertion orthopically to the respective side in UP. 82. Neuroblastoma. Increases aorta and inferior cavern across the midline. 83. Purochromosarcoma associated with Men medically thyroid. Correct answer. All options were correct, but associated with men the most 50%. 84. Bilateral adrenal mass plus hypertension related leading to surgery. What to expect now? Men medically thyroid. 85. Testicular mesothelioma associated with germ cell tumor. 86. Abortion case with open us, inevitable abortion. MCQs MCPS 25th January 2017. January 2017, okay. Next. One question on one, which structure is immediately lateral to putamen? External capsule. 2. Scenario for extra rubber castration, blood supply from aorta. Question number 3. Rib notching is seen in superior vena obstruction. Look here. Inferior rib notching is seen in carotid aorta, superior vena obstruction, and arteriovenous malformation. If here rib notching is seen, cardiac disease. NF1, carotid aorta or superior vena obstruction, and AVM shows inferior rib notching. Superior rib notching is seen in osteogenesis imperfecta, Marfan syndrome, hyperparathyroidism. Memorize this. Question number 4. At 100 kV, which interaction is going on? Abraham Solomon. Question number 5. Regarding tube reading, what does shift toward right or left mean? Question number 6. 43-year-old male with secondary infertility and left caudal swelling, diagnosis is varicocele or shows dilated vessel. 6. 43-year-old man with secondary infertility and left caudal swelling, diagnosis dilated vessel or varicocele. Question number 7. The current dilatation of caudal vessel, size of vessel in moderate dilatation is greater than 2 to 3 mm. Moderate dilatation is greater than 2 to 3 mm. In relaxation, it is 4 to 5 mm. And Valsalva is 1.2 to 1.5 mm plus with it 4 to 5 mm. In moderate dilatation, is size of vessel varicocele is greater than 2.3 mm. And in relaxation state, in moderate dilatation, it is 2 to 5 mm. On Valsalva, because on Valsalva it will be 1.2 to 1.5 mm plus what it was on relaxation. Question number 8. Regarding PCP, pulmonary cardiac pneumonia, what is correct? Perihilar and perturbates. Number 9. Fallen fragment sign is seen in which case? Simple bone cyst. 10. Unit of absorbed dose is gray. Look here. This is the varicocele normal grading. Now, there's normal varicocele, small varicocele, and large varicocele. In normal varicocele, on relaxed stage, it is 2.2 mm. And on Valsalva, it is 2.7 mm. Valsalva, remember, they're plus 1.5 or 1.2 mm to, or 1.5 mm to whatever relaxed stage is. On small varicocele, it is 2.5 mm relaxed stage, and plus Valsalva is plus 1.5. Large varicocele is 4 mm, greater than 5 mm, and on Valsalva, it is plus 1.5 mm. And moderate varicocele is 4 mm, and on Valsalva, is plus 1.5 mm. Let's memorize. Moderate varicocele, there is 4 mm, then just 1 centimeter before moderate is small, and 1 centimeter plus moderate is large. 4 mm is moderate varicocele, 4 plus 1 is 5 mm, so 5 mm is large varicocele, and 4 minus 1 is 3 mm, so small varicocele is 2.5 or 3 mm, and the normal will be 2 to 1 2 mm. So here is moderate dilatation of varicocele is greater than 2 to 3 mm, because it is 4 mm. Now, okay, question number 6. Remember this, battering appearance is seen in, and refers to battering appearance. Battering appearance seen in pulmonary edema, pulmonary aspiration, pneumocystis purinae, pneumonia, and pulmonary alveolar proteinosis, and pulmonary hemorrhage, lymphoma, leukemia, bronchogenic carcinoma, bronchoalveolar carcinoma show battering appearance. Reverse battering appearance seen in chronic eosinophilic pneumonia, cryptogenic organic pneumonia, and same as battering appearance. They both revert battering and battering have same causes, nearly same causes. Just the chronic eosinophilic pneumonia and cryptogenic pneumonia see revert battering appearance. Rest all pulmonary hemorrhage, pulmonary edema, pulmonary aspirations, they both are seen in show revert battering and battering appearance both. Let's memorize this. Okay, now question number 11 factors affecting X-ray beam energy. This is not important.